Hi, it's Dr. Rosenberg again. I wanted to continue our discussion on back pain and exercise for back pain because it is a very important area and a very confused area. And this session I'd like to focus a little bit more on the two kinds of stretching exercises. As we discussed when we talked about back pain, there are a lot of things, there's a lot of anatomy in the low back that can cause pain. It can be the nerve roots, it can be the discs, it can be the joints, it can be the tendons and the muscles that overlay the process. So in the 50s, an orthopedic surgeon by the name of Dr. Williams created a set of exercises known as Williams flexion exercises. And basically he said that lordosis, or curving back of our spine, is the price we pay for being a two-legged animal. When we're born, we are born as a little baby with a completely curved spine. When we lift our head up, we get the cervical lordotic curve because we had to lift our heads up. And when we learn to stand on two legs, we get the lumbar curve. That's the price we pay for getting up on two legs. So Williams decided that one of the problems with back pain is that everything's all crunched together because we are arching our backwards, we're crunching everything together, and that can't be a good thing. So he designed exercises called Williams flexion, where basically you bend forward at the waist and just try to stretch everything out. Take the pressure off the disc, take the pressure off the nerve root, take the pressure off the disc, stretch the muscles, just like you would stretch a cramp if you had one. And that exercise, which I've demonstrated previously, is to bend forward at the waist and just stretch it out. And you can do it with one leg, you can do it with the other leg. That's the Williams flexion program. Very simple, takes less than 5 minutes. And if you did it 3 times a day, if every back patient did those 3 exercises 3 times a day for 5 minutes, I guarantee their back pain would improve to some amount. Now, in the 60s, there was a physiatrist, a physical medicine and rehabilitation specialist like myself, named Hans Kraus. He had the distinction of being JFK's, John Fitzgerald Kennedy's, back doctor, and needless to say, that gave him a lot of access and power. So he got together with Williams and the YMCAs, and as part of Jack Kennedy's program for health, for Americans to stand up and get healthy, in the 60s is when they first introduced physical education into the schools, and there was a real push on Americans to get fit. So Hans Kraus and Dr. Williams were able to introduce the Williams flexion program into the YMCAs, and they gathered data on literally hundreds of thousands of patients doing their exercises with back pain across the United States. And they had tremendous results, and it still remains a mainstay of treatment for the back. In contrast to that, in I believe the 70s or 80s, a physical therapist in Europe by the name of Mackenzie decided that Dr. Williams had it wrong, that lumbar lordosis was not in fact the price you pay for being a two-legged animal, that in fact it is a design feature that helps the back. Because if you were to continue that arching process, you would create a forward vector pressure that would bring the disc forward and off the nerve root. And so he developed an exercise program called the Mackenzie Extension Program, the exact opposite of Williams flexion. Instead of bending forward at the waist, they encourage arching backward at the waist, trying to get that disc out of the way, out of that posterior element. And because Mackenzie was a physical therapist, obviously many physical therapists were very enamored with his technique, and it's become a very popular technique in the United States. What is odd to me is that they're completely two opposite techniques. One's bending forward, one's extending backwards. And I don't understand why I get patients that come in and they're doing both kinds of stretching. It just doesn't make sense to me. So I get a simple rule. Whatever works. So I'll have a patient bend forward. If they feel better bending forward, I give them Williams flexion exercises. If they feel better arching backwards, I give them Mackenzie extension exercises. So we're not locked into one idea. What works for the individual patient is what we will focus on, and that's the key. So I would encourage you to do one or the other and figure out which works best for you. And it's an interesting problem. I'd say in my experience, my personal experience, I'd say 9 out of 10 patients do better with Williams flexion exercises. Probably 1 out of 10 patients does better with Mackenzie exercises. I suspect those patients that do better with Mackenzie exercises probably have primarily disc pathology as opposed to the other possible pain sources. Although on MRIs it's not really that clear. So again, my attitude is whatever works, but it's easy enough to figure out. Bend forward, arch backwards, and decide what works. It's Dr. Rosenberg saying goodbye.